Hi, everybody. Lou Manzo here with you again. Hope that you are faring well as we continue to navigate this coronavirus thing that we're dealing with. I know we are continuing in the week of Passover for some, and we're on the heels of the Easter weekend. So I'm hoping that it was as pleasant as it could have been this past weekend with your families, probably social distancing and doing some virtual meetings as we did. But we enter the week now, and obviously, I'll begin writing my updates. This is probably, where you're getting this link to this video from, the update that I wrote on Monday. You're looking at it Monday night. And I just want to stress again, as I put the numbers in those updates, that talks about the number of cases countywide and obviously in Harrison, and it starts to reference deaths in Gloucester County. I've written about this already. It's easy to just become numb to that. I'll ask you just to keep those families in your thoughts, in your prayers. If you're a person of faith, however you would do that in your private moments, to keep those families that are being affected in the most horrific way, because most of us are not touched in that manner. I'm in a position where I'm hearing from a lot of you, and I'm telling you it's all around us. People in our community that are affected. Luckily, we've had no one lose their life yet, but they know people that have, and it's happening in our county. It's happening around us. So let's keep that in our minds as we continue to get through this over these next few weeks. I want to just give you a couple technical updates. Gloucester County will be sponsoring their second drive-through test center that I talked about last week. That's going to happen this Thursday, April 16th. As of this morning, Monday morning, you are able to call in, because it is, again, by appointment only. You have to call in directly, go through a pre-screening questionnaire, and then an appointment will be issued to you so you can show up on Thursday. In my update, it has that phone number, but it's 856-218-4942. Call them directly. And locally, we continue to do things to keep services up and running in town, but also brainstorming. The 5 committee members, we're talking to each other multiple times during the day, texting a lot, to just come up with different things that we can do to help our residents directly. That's where that outreach program was born a few weeks ago. You heard about that, where a couple of our committee people oversaw the process of calling out to seniors and those most in harm's way in our community. And that process has taken place. And recently you read about the mask distribution, where we donated 5,000 masks to the hospital. Bringing in our guests here with us now, and they're on screen with us. We got Deputy Mayor Don Heim and Committeeman Adam Wingate. Welcome, guys. How we doing?
Mayor, how are you? Adam, hello.
Good. So I'm bringing them in today to talk about another aspect of this continual focus we have on helping our residents. As I said, last week you read about the donation of 5,000 masks to the hospital and how that was born and how that came about. We're going to talk a little bit more about that today, because you may have already read in the update some of the details with what I'll call a second wave that is more resident focused when it comes to masks. And the 2 people along with us here today are obviously also elected officials like me, but they're also residents like me, a business owner in town, another member, Deputy Mayor Heim, who oversees one of the youth organizations, sports organizations in town. And it was those 2 gentlemen, coupled with business owner Kenny Patel of Dunkin' Donuts, that were the initial benefactors of that 5,000 mask purchase that went to the hospital. So I'll start with, going to you, Donnie. And on the heels of that initial mask donation that you were involved with, along with Adam and Kenny Patel, tell us a little bit about what this second wave of mask-centric conversation is about. Tell us a little bit about that.
It's a little interesting. We no sooner had received the masks, we were able to make the drop off to the hospital, and we were sitting around discussing the process of getting them for the hospital. And just out of normal conversation, it came up: what else could we possibly do to take this to the next level? How can we get more masks for the hospital, especially since the way they reported was what we donated to them was only going to last for a finite amount of time. And that finite amount of time was a lot less than what any of us had thought it was going to be. So we sat there kind of brainstorming a little bit subsequent to delivering those masks about how we could do this on the next level, get more masks for the hospital and the healthcare workers, but also see if we could do something for the residents in town and how we could pull this off in a way to do both the right thing for the town and the right thing for the healthcare workers that desperately need them. The first step was to see if we could actually get a hold of the masks. We went back to Kenny Patel, who was very instrumental in assisting us in getting the first 5,000 masks. Kenny was very optimistic that we could obtain more masks than we thought we would need, between 15 and 20,000 more masks to kind of do this right. So right away, Kenny said, sure, I think we can pull this off. Adam and I looked at each other and were in disbelief to some degree that this might actually come together. We put it into Kenny's hands, and I believe later that night, Kenny and Adam got on the phone, and Kenny confirmed to Adam that he was able to get another supply of masks, and we thought we would be able to get as many as 20,000 masks. Right, Adam?
Yes.
Yeah, so Adam, you were kind of interacting with Kenny at that point, going back and forth. Who else was involved? Well, really, as far as paying for these masks, because they do cost money, and if it's going to be a donation, we're not asking for people to pay for them. How did that occur? Who was involved, and how's it being paid for?
Yeah, so when Kenny said that he could get these 20,000 masks, I said, well, what are we talking fiscally here, financially, what are we talking about? And, it came roughly around $15,000. Since Harrison Township Day is not, being canceled because of COVID-19, what we decided to do was actually reach out to all the donators that donated to Harrison Township Day. That list is going through as we speak right now. The majority of the answers so far were absolutely, you can keep our donation, put it towards the mask. But not only that, they're also turning around instantly saying, is there anything else we can do? Anything else we can donate, time, money, to help you, pay for all this?
Yeah, that's, again, been the common theme since this thing has started, the people in this community, and I'm sure that's the case in a lot of communities, just stepping up and wanting to be involved, engaged, help in any manner they can. So it really does, make you feel good when you hear that kind of stuff. So that's how it's going to be paid for. We're basically going to have all of the individuals from Harrison Township Day that had donated, and those that are willing to still have that money directed towards purchasing these masks. That's how it's being funded.
Right, and not only that though, the 5 committee members, you, Mayor, Deputy Mayor, myself, John, and Julie, we've also decided to forfeit and donate our second quarter check, which roughly comes to a sum of $5,000 towards the rest of the amount that we need.
Wait a minute, $5,000? I mean, that's the total. That's what people always say to me when we talk about that. But
yes,
making light of it in this case. But clearly, we wanted to put skin in the game as residential work, from our perspective also. So, you had already done that as a business owner, Adam, Donnie, and representing the basketball organization in town. They had stepped up. So now we individually also were willing to do the same. So that's how it's going to be paid for. Good. As far as logistics, Donnie, talk a little bit about what the logistics of getting these masks out to the residents will be, and how it's going to work, and why this limitation of 2 per household came up. Where was that?
You would think that this would be the easiest part of the puzzle to put together, and actually, this is the toughest part of the puzzle to put together. Obtaining the masks seemed to go very fluid. Coming up with the funds seems to be going very well with the Harrison Township benefactors assisting us with the Township Committee forfeiting their second quarter paycheck. The logistics is the toughest part of this. Can we pull this off? Is it legally, are we able to do this? And we had to go through the legal measures of talking with our township solicitor, making sure we were okay in doing this. We got that all taken care of. Then it was a matter of talking with our police department, with the chief and the captain, and making sure that they were okay with a central pickup location. It's going to be very busy at that location. That location is going to be Pleasant Valley School. Coordinating with the school itself And then just a matter of getting our residents to the site to be able to drive through, stop, pick up their masks, and then pull out without there being a nightmare on Walters Road or on Cedar Road. That's all been worked out in the background. Our legal department has been very good about getting us an idea of what we are capable of doing, and we realize we can pull this off. Our police department has been unbelievably helpful in being able to assist us with directing traffic on that day, providing officers both at not only at the entrances to the school, but along the path where the cars will go, checking IDs. People come in and make sure that they have a Harrison Township address. Everybody will be required who comes up to show their driver's license. Through their window is fine. We're not going to take their driver's license off of them to show it through their window. Verify that they are a Harrison Township resident, and then they can go and collect their masks. Mayor, you had mentioned that we're going to try to limit it to 2. It's very difficult. We would love to give a mask to every person who lives in the town. We're limited in what we can do. And we also want to be limitating in what we can do because we are under quarantine. We aren't supposed to be going out. We need to limit those that are going out. That's part of flattening the curve, part of beating down this dilemma. And if we're able to give 2 masks to every household, it pretty much provides the parents of the household the ability to go to the supermarket, to go to Heritage or CVS or Rite Aid, if they're an essential worker or a healthcare worker, that they can get out and go where they need to go. And if they have to stop somewhere, they have a mask and they have the ability to do that. But we don't want to just promote the idea that we're giving masks out to every member of the household, and then that kind of sets thoughts in motion that everybody's okay to go out and start functioning again. And we're not there yet. We're not there yet. We all want to get there. We're just not there yet. So we're kind of, because we're limited to the amount that we have, and we want to be limitating in being social, make it only necessary and mandatory type of social, supermarkets, drugstores, doctor's visits, things like that. We're keeping it to 2 per family for all the residents in town.
Right. So to pivot off of what you said a little bit, there was a lot of discussion about, the safe and sanitary way to be able to distribute these masks, and based on input from medical professionals. You mentioned that what the distribution point is going to be like, overseen by our police officers and identification. The mask will actually be handed to you by individuals who are wearing masks themselves and wearing gloves. They'll come out of a box that's fresh from the manufacturer, never touched before, and handled and put into plastic bags. We had some conversation about that. So literally they will be held up by their string, their ear loops, and handed to you. And that's the first time they'll be touched. And then in my update, it does talk about, the care of those masks and the use of those masks. So there's a lot of attention paid to that. And the 2, as you said, is really meant to be a limiting factor. This isn't an invitation to go out and to put masks on the whole family and start hanging out in the neighborhood. This is because we know you have to go out for certain things. This is going to give you the peace of mind. That's really what we were trying to do here. More than logistic, it's more emotional almost in a way. We are going to provide, we the town, your hometown, are going to provide these masks for you to give you that peace of mind when you're put in a position to have to go out of your house. So Adam, another portion of what we talked about when it came to everything I just said was the fact that we know that there is a prioritization to make sure that hospitals, healthcare facilities, healthcare workers are addressed first before we just hand them out to our residents. Tell us a little bit about that and what we came up with for that.
So what we did, after we, took care of the hospital, made sure they were, like Deputy Mayor Heim talked about, they were taken care of for a certain amount of time. We also reached out to our fire department, our police department, local doctors' offices. One did actually, the local OBGYN did ask for some masks for the pregnant mothers. So we were able to carve out some of those, possibly 200 masks, and take it to them and donate to them as well. After the residents are taken care of, the masks that are left over, we're going to revisit, the hospital, the fire department, the police department, just to make sure that, everybody that needs them after the residents are taken care of.
And what about the residents that actually are healthcare workers, wherever that might be?
So, they're going to be able to get extra masks, about 4 or 5 in total. The reason they're getting extra masks is, they're the ones that are going out every day and, being on the front line of it, and to come home to their families safe and have extra masks is what they really need.
Yes, so that thought process, and again, the doctors really that we spoke to kind of drove home the fact that, all right, after the hospital facilities themselves, and we've spoken directly to Inspira, to Kennedy Jefferson, to Cooper about the need for these type of surgical masks. These are not N95 masks. They're not being given out. They're only for healthcare workers in the hospital. These are the typical surgical masks that are pleated that we've all seen before. We reached directly out to the hospitals. The healthcare workers in our hometown are going to be able to get a few more masks than the 2 limitation. They are going to have to show some type of facility or healthcare ID, where you work, something that proves that you're a healthcare worker of some kind. And then we will give you additional masks so that you can, within the 4 walls of your home, protect your family, because you're going out every day, into the face of this beast that you're dealing with. Theoretically, even just in your own 4 walls, you need to protect your family, and we want to recognize that. So that's the special consideration for healthcare workers that Adam's talking about. I mean, it's great stuff. I mean, I know that we all feel blessed to live in a community that steps up in the manner it does and gives us as the leadership the ability to even talk about this as an option. It's really special. Before we wrap it up, any closing thoughts, anything else you'd like to say, Deputy Mayor Hein?
One thing we wanted to address was our residents that live in Spicer Estates, Mayor. Spicer Estates is our over 55 community in town, and we've gone through the outreach program with a lot of the residents in that area. One of the things we're going to do to try to make this easier for our residents who live in Spicer is have them delivered with our volunteers and some township workers, get them delivered to Spicer Estates, to the residents in Spicer Estates. They have to limit them having to come out, make it easier on them, just provide a little bit extra service in that regard. So we kind of thought this through 50 different ways of how we were going to do this whole process logistically, and that's one of the things that helps us logistically do that. Subsequent to that, I'll just leave you with this. All these things that we're doing are born out of whatever was done before it. First with the outreach program, and then with the initial 5,000 masks to the hospital. It then evolved into this, where we're able to give 20,000 masks to residents and healthcare workers, essential caregivers. I can't wait for the next idea of what we can do. We're sitting around brainstorming individually, through text back and forth, through video conferences back and forth, taking a look and talking to residents about what we can do to assist and make things better. Your updates every day have provided unbelievable guidance and information, keep everyone informed. It just goes above and beyond, and I hesitate to say it goes above and beyond because you're simply doing what needs to be done. It's what is expected by the residents of our town, and you're delivering every day with it. And we're going to continue to look to deliver every day until this thing is beaten down and we've conquered it.
Great. Yeah, so Spicer will get a delivery in their mailbox, I guess, at some point later in this week, in a plastic bag of 2 masks. Again, refer to the details in the update to talk about the days and times. It's Wednesday and Thursday, 2 to 6, Saturday, 10 to 1. All those details in the process is included in the update that is written. You probably have looked at it to get to this link. And closing thought from you, Mr. Wingate?
Yeah, there is no community without unity, and unity is absolutely a major strength that we've all witnessed, in these times. From the residents that have been reaching out to offer a hand, suggestion, or even just words of gratitude, to the township employees, the police and fire department, and obviously you, Mayor, Deputy Mayor, John and Julie. Can't thank you guys enough for making this easier to get through these hard times. And there is light at the end of the tunnel.
So we'll close with that. Can't be anything more profound than the light at the end of the tunnel symbol that has now become part of what we've been talking about. We all know that that's true. We stick together. We stay the course. We stay Harrison strong.
Yes, sir.
We'll see you soon.
Thank you.